Hello, hello. I'm Ray Du Bois. I'm the director of the Hollings Cancer Center and the dean of the College of Medicine. And we're here to talk about COVID-19 vaccinations in cancer patients.
Hi, Ray. Ray's my boss, so I'm going to be very nice to him and deferential. But my name's David Mavi. I'm a pancreatic cancer surgeon at MUSC and also the head of the service line for cancer for the healthcare system, which includes medical oncology and radiation oncology. So thanks for having us. I've never been on Facebook Live before. It's kind of cool.
Thanks for being here, Dr. Mavi. One of the questions that came up is why did we get vaccinated? Well, I actually participated in a clinical vaccine trial, one of the ones that was held here at MUSC with the AstraZeneca vaccine. And I got it a few months ago, actually. And after the other vaccines became available with emergency use authorization, they told me that I actually did get the real vaccine. So that's how I got it.
Well, I actually got it the first day it was available to the healthcare workers. I mean, I do lots of surgery, and I always felt relatively unsafe walking around. I know it's probably overstating it, but I really wanted to be able to talk to my patients without a mask on, and I wanted to feel a little more comfortable. And felt a little bit like a weight lifted off my shoulder. I felt really good when I got my second vaccine. A little bit of time passed, but I really wanted to be able to more. It's very difficult to talk to cancer patients with a mask on, with them having a mask on. It's just a difficult discussion, and we have lots of discussions about what are we going to do next, and I think it's more helpful to do it without a mask on. I know it doesn't seem to matter that much, but it matters, I think, to patients. So that was why I did it.
Yeah, I was in the trial just to try to get as much information as possible on how good the vaccines work. So, and I could get it earlier. One question that comes up commonly is it safe for cancer patients to get the vaccine? It turns out, I'm sure Dave can give you his experiences, but I did have a sore arm. I had some muscle aches and a headache for 24 to 36 hours. But after that, it was everything went away, and I felt pretty normal. And it is pretty safe for cancer patients to get the vaccine. There are some situations where people have allergies to polyethylene glycol, which is in the Pfizer vaccine, which you really could have an adverse reaction in that case. It's a very rare allergy, but that's one situation. And then some patients getting bone marrow transplantation who have no immune cells. The other question that comes up sometimes is it safe for cancer patients to get any type of vaccine? And I think it's pretty safe, except for live viruses are not safe in cancer patients. So, and I don't know of many of those that are left over other than maybe polio or something like that.
Yeah, the COVID vaccine, just so everybody, we can't reiterate this enough, is not a live virus. It's you can't get COVID from a COVID vaccine. The ones that we use are stimulate your immune system, but they don't expose you to the risk of developing the disease. So we think it's extremely safe for cancer patients, with the one caveat being that it may not work. If your immune system's compromised, the vaccine may not develop an immune response, and that's particularly important information in patients with bone marrow transplants and things like that. But really, it's almost a no harm, no foul thing. If you get a vaccine, it doesn't work, you can always get another vaccine later. So rather than trying to segregate exactly who should get it, we've cast a big net and said, we think every cancer patient should have the COVID vaccine.
And, I don't know about you, Dave, but I get called several times a day from people that want to get the vaccine. So another question is, are these vaccines available for cancer patients? And right now, here in South Carolina, we're still on the 1A subcategory, which includes healthcare workers, nursing home residents, and people over the age of 65 now. That's been decreased. So if you are a cancer patient, you're over 65, you definitely are eligible for it. But it's having cancer is not one of the indications in South Carolina. Although I did talk to my colleagues at MD Anderson this morning, and they are giving the vaccine in Texas to cancer patients.
Yeah, I mean, we're obviously cancer physicians, and we feel really strongly that this should be extended to those. I believe the cancer patient for everybody would start with, I think, 1C,
Mm-hmm.
which is patients with comorbidities. And we would think of cancer as a comorbidity, meaning even if you're less than 65, if you have certainly active cancer that's being treated, that's a comorbidity. Really should have a vaccine, to whatever their age would be.
Yeah, I agree completely. And I would advocate strongly for vaccinating cancer patients per se because of the poor outcome of those patients when they've been infected with the virus. Uh, the other issue with cancer that comes up is you can actually divide our patients into three categories. One is prior to initiation of chemo or immune therapy. Second are people being actively treated, and those were excluded from the vaccine trials. And then the third are the survivors that are long-term survivors of cancer. And clearly, we should vaccinate prior to initiation of treatment. That's the chance for the best response. And during treatment as well. And survivors clearly are a higher category, but probably lower than those two.
Yeah, I think using the 1C for the survivors, I feel comfortable with. I would really hope that South Carolina would begin to vaccinate patients with active cancer under treatment earlier than that. We've really advocated our patients that are being treated over 65 to get the vaccine. So I at least have been very adamant. Every patient I say, you've had your vaccine, have you had your vaccine? And even patients in the hospital that have had surgery, we've patients, usually we wait a week or so after their procedure, but we still very much try to vaccinate people as quickly as we can.
Yeah, I agree. And then people want to know if cancer patients were included in the vaccine trials. And I think some were just because of the mass number of people that were included. But there was an exclusion criteria for individuals who, had within 6 months had chemo or immune modifying therapy. So those individuals weren't tested in most of the trials.
Yeah, so we really don't know. Getting back to my last point, though, I think even if we don't know, there's eventually going to be an enormous supply of vaccines in the world, and we should vaccinate everybody. And if we'll vaccinate people again, but there's not a lot of data in patients who are actively getting chemotherapy or immunotherapy that a vaccine doesn't work. I don't think there's any data. So in the lack of that, I would always, I think the risks of developing a COVID infection for someone actively being treated for cancer is much riskier than getting the vaccine. So we certainly advocate for everybody to have a vaccine.
Yeah, I agree completely. I think the other thing that is interesting when you look at all of the data cumulatively, that getting the vaccine, even though we don't know if it obviously doesn't protect 100% of people, but it's pretty good, 95%. But even if you do get infected and you've had the vaccine, you don't require a hospitalization or other major intervention, ventilation, things like that have high morbidity, mortality. So it is, I agree with Dr. Mavi. It's always better to get the vaccine, get whatever protection you can, and then go forward from there. There'll probably booster shots coming later. There are variants of the virus developing, and we're just continuing to learn about those. But our current vaccines look pretty good at covering some protection from those as well.
And I think having gotten the vaccine, it makes me feel to be in the hospital and be out in public. I still wear a mask, but because I know that even if I develop the infection, I'm not going to get really sick, and I can keep working and keep family. So I would encourage everybody that has access to the vaccine to get the vaccine.
And then I guess we're open for questions if anybody has a question they want to fire in. No questions. Okay. Well, thanks for listening, and you'll hear more from Hollings as we go forward on this and many other topics related to cancer care.
All right. It was great.
Thank you.
Thank you.